Hello, and welcome to today's episode on electroglottography and the closing factor. In our first presentation on electroglottography, we showed the various parts of the curves that we used in our calculations. Just as a reminder, we present the overview again with the various distances in time that we try to differentiate. In this figure, we show how we manually tried to differentiate the various parts of the duty cycle in time on electroglottography. In this picture, we show a comparison on the electroglottography of 20 hospital employees compared with 26 music students. It's very clear that the A is bigger in the music students, but in the music students, the A in relation to B is bigger. A is where the closure begins on the drawing till the maximum closure. The discussion about this is endless because the real difference probably lies in the amplitude of a much better function of the vocal fold muscles in the music students. Maybe this can be documented later on with chomography. Stroboscopy is until now our most secure way of defining the glottal closure, eventually with other visualization techniques. The question of glottal closure can only be answered by using stroboscopic or other visualization techniques, as well as the binary decision glottis closed during phonation and glottis not closed during phonation. It is also important to describe the type of incomplete closure of the glottis. The following categories are distinguished: ventral gap, dorsal gap, continuous chink-shaped gap, spindle-shaped gap, hourglass glottis, irregular gap. A common method for visualizing the vocal fold movements is presented in this paper, where the authors try to combine stroboscopy with optical coherence tomography in vitro with 50 movements per second. In our calculations, we use the closed quotient and agree with the firm glottal enterprise, which defines the closed quotient as the inflection of the duty cycle. This is exactly the discussion that is going on. What is the closed quotient and what is the contact quotient? And they should not be used interchangeably. They relate to different physiological phenomenon. Electroglottography has some interest to define genetic aspects of voice pathology as well as medical disorders before and after pharmacological treatment, as in this example. Dystonia has been hard to document objectively because the changes come and go, but here you see the electroglottography of a dystonic patient, which certainly is impressive, with two different kinds of abnormality of the electroglottographic curves. If you look at the dystonic patient's electroglottographic curve, it is visually clear that it is abnormal. We have also made pictures after treatment and can see that the electroglottography becomes more normal. Electroglottography is very interesting, and there is much more work to do to differentiate the various forms of curves. Thank you for watching, and we will see you in the next one.